Good morning, everyone. It's 7:42 right now, and we're talking mental health care here in the state of Iowa. We have some mental health care advocates in studio with us. Mary Neubauer and Larry Loss are here. We just heard their story and what a powerful message that was able to portray. But now we need to take some action, Jackie, and we need to take some action quickly.
Absolutely, and we're very blessed this year, I would say, to have a governor who's making this a priority. But we need more than that. We need our neighbors and community members and people watching today to raise their voice so that we can make change, because things are happening at the State House literally this week, correct?
Right.
There are. So the Iowa State Association of Counties, whose video you just showed, they are at the State House Wednesday and Thursday talking with legislators, pushing the importance of mental health care and the changes that are underway. The governor also has introduced a bill to establish a children's mental health system in Iowa for the first time. That's amazing if you think about it. This legislation has been 30 years in the making that people have been talking about.
So it was brought up that long ago, three decades ago, but it was an idea, and it would stay as an idea.
Right, and it finally took people talking about it and saying, I'm being impacted, my family is being impacted, all over Iowa, for folks to listen and to finally introduce a bill this year. And amazingly, it's making its way through the legislative process. It's one thing for a proposal to be introduced. It's another thing for it to actually move through the process, and that is happening.
Let's talk about, because I think the numbers are starting to come out about how many individuals and families actually do suffer from some sort of mental health disorder. But back in the day, it was a stigma. You didn't talk about it. You didn't want to talk about it. It was taboo. But now we're saying, please, let's talk about it. Let's share those stories and let our voices be heard.
Right. Well, two things. One, people that are suffering become very good at masking that they're suffering. And number two, the stigma that goes with having a mental health issue has been just, a powerful deterrent to keep people from speaking out. But we used to talk with Sergey. We'd tell him it's not being weak to talk about this, it's being strong. And so we tell people, it actually is being strong to speak up and to say that you need help.
Right.
That's a very important thing. And thankfully now more and more people are speaking up and saying, hey, I have this problem, I need some help.
Larry, that is a powerful statement, and that is very true. You are not considered weak.
Right.
To discuss this, you are exactly considered strong.
It takes an incredible amount of strength to say, I need help. And if you're already suffering, it's double or triple hard to do that. So just encourage everybody, if you need help, please ask. People are there, they want to help you. But you have to let them know you need it.
Okay, so besides if you're someone that's suffering and saying, I need assistance, what as a community can we do to raise our voices and say this needs to be continued to look at, not just an idea that 30 years from now we'll look at again, but right now so we can make a difference in our state?
Well, as I said, there are a couple pieces of legislation that have been introduced at the Capitol. One is the governor's children's mental health system bill, and I know that you have a contact page for legislators, so if you're not sure who your local legislators are, it's very easy to find that. You go to the Iowa Legislative website, and there's a link on there where it says find your legislator. So you contact your local senator, your local representative, and you say, I want this bill to be passed.
Okay, the governor bills that you're looking at now is Senate File 479 on the Senate side, and the House side is House Study Bill 206.
Yeah, and you don't necessarily have to have those exact numbers.
No, but just so you know.
Right. No, it's good to have those numbers, but you can just say, I want a children's mental health system here in Iowa for all of those kids who need that assistance, for all of those families that need that assistance. And legislators are listening, and as I said, those bills are moving, but it's important that people make their voices heard, because things can move really quickly at this time of year at the Capitol.
Absolutely, and if people want to learn more, if they want to watch your video again to continue to be inspired or maybe share that with others, there's a website they can go to learn more about that.
Yeah, and that's the Iowa State Association of Counties. They have that website and all sorts of information on that website that says mental health matters, and there are a number of links that they can go to. That's an incredible resources that the counties have put together, because they have been the ones on the front line of providing services all these years.
Right. Now, would this be a website that even if somebody may be experiencing some of the things we've been talking about here today, where they might be able to get some answers and maybe some key words or phrases they could use to start talking about it?
Yeah, definitely. And then another great website for everybody to go to at any time is the National National Association of Mental Illness. It's an organization known as NAMI, just NAMI.
Okay.
That's another great one to go to. They have all sorts of information out there for families, for folks who are suffering, and also resources that you can get to right away.
How about that? So what is the next step now? Beside people making contact with their legislators saying we need to get this passed now or get this taken a look at, what do we need to do next?
You know, truly, I think one of the easiest things and best things for people to do is just continue to talk about this. You know, if you're someone who's suffering, have the courage, have the strength to say, this is my story, this is how it's impacted my life, particularly if you're a loved one who's helping someone who's struggling. Share your story, say why it matters, because that's how change occurs, is when people can see families are being impacted, people are being impacted. That's what brings change about.
And something that kind of goes along with the website that you were talking about, Camp High for Kids, I believe is
for Kids, yeah.
Thank you, is another integration of that. So another resource if people are needing some more information, if you want to learn more about the advancement of mental health in Iowa for specifically kids,
right.
This is another resource.
That's an organization of mental health experts from all over the state who have banded together to support the governor's children's system bill. But they also have incredible information on there about the types of services that are needed and the help that the experts, would like to see here in Iowa. And from my perspective, when healthcare experts speak, we probably should listen, because they're the ones who know what is needed and what resources they currently have available.
Right, and speaking of resources being made available, with all the research that you have done, both of you have done, trying to find help for Sergey, what is the closest facility that might be able to offer some help? Is it as far away as Arizona?
Luckily we have great emergency services here in Iowa, so when people are at the height of their crisis, you can get into the hospital for maybe 5 days to 7 days.
Okay.
What's missing here in Iowa is that extended care.
Okay.
There are programs that are in the process of building out that care right now, but it simply doesn't exist here. University of Iowa Hospitals in Iowa City is a great facility, but they truly are backed up maybe 3 to 6 months for someone to even get an appointment. So unfortunately, if you're looking for that extended care, often you are talking out of state, and that's really difficult for a lot of families to achieve.
And what we did find out of state is there are facilities, but even those have waiting lists that can be weeks to months to get in. And if you're struggling,
you need help
you
now.
need help now, not in 2 months I can go someplace to try and get help. So we need to try and work with our communities, with the counties, with the state, everybody, to try and build out more resources for Iowans who are in need.
Absolutely. So let's all become Sergey soldiers and work
you.
together to make a difference in our state. We can't thank you both enough
Thanks
for
having us
spending
on.
time with
Thank
us
you
this
for
morning
doing
and
all
sharing your story.
Thank you. This is a really valuable time.
Thank you. And Larry, how about one of those bracelets? Can I have one of those?
Yeah, we brought some.
Yes, you can. I always wear 2 so I can give 1 away.
That's what I heard. So that's the reason we
But
have
today
it.
we'll give 2 away.
Hey, I appreciate that very much, sir.
There you
And
go.
we'll wear
Thank
these with pride. Thank you very
you.
Thank
much.
you so much for being here. All right.